Hello, everybody. It's Russ Curtis, professor of counseling. Thanks for joining me today. I want to talk about the essence of cognitive behavioral therapy. It's easy to get mixed up in the details of these different theories, and oftentimes in a textbook, we'll combine Ellis with Beck and Meichenbaum. And so let's talk about, if we're practitioners, what is the essence of what we're trying to do with cognitive behavioral therapy? And this is one of the most evidence-based theories out there. So we know that it can be an effective treatment for others. The essence, I believe, is that thoughts have creative potential for good or bad. And so that we need to pay attention to what we're focusing on. Now, here's the deal. We all have thoughts that are bizarre or even harmful or strange, however you want to label it. What we focus on tends to be, from some sources would argue that what we really spend a lot of time focusing on is what we're actually creating in our lives. And so we want to pay attention to what we feed ourselves in terms of our thoughts, if you will. We would not expect to feel good if we ate fast food and junk food 3 meals a day for months. We would be able to easily say, wow, I'm not feeling good. And I can look back to at least a part of that is what I'm feeding myself. The same would be true with our thoughts. And so that, I believe, is the essence of cognitive behavioral therapy. No matter how it's actually practiced, it is what are we actually doing, and what are we thinking about, what are we focusing on. So, what are the other theories that are related to this? Solution focused, because I solution focus sometimes gets this. People that don't understand the theory will think that this is, oh, it's a band-aid, it's a quick fix. Actually, solution focus is about changing the narrative, and really fundamentally is about helping people remember times in their past when they've handled hard situations or they have solved problems before. What we're trying to do with solution focus is bring that back up into the memory to where it lights up the neural network of remembrance that, oh, yes, I have solved hard problems before. I have been assertive when I've needed to. I have dealt with adversity when I needed to. So solution focus is, to me, one of the most evolved theories. And it truly is helping us at a neurological level, I believe. And frankly, narrative therapy is very related to that as well. It is very much related to changing our narrative, and that we do have the power of doing that. I think acceptance and commitment therapy is related to this as well, because acceptance and commitment will say, hey, your thought, you get to diffuse from that thought. The thought that I am anxious can be, this is anxiety. And I am more than the anxiety. Arguably, well, not arguably, but also mindfulness. Clearly, mindfulness is a metacognitive strategy of helping us recognize that we are not our thoughts. We get to choose which ones to focus on, and we can kind of observe our thoughts. We can name our thoughts and say, oh, that's the thought about anxiety. That's the thought about insecurity. But I don't have to entertain that thought. So ultimately, the essence of cognitive behavioral therapy related to these other theories is thoughts have creative potential. We need to pay attention to what we're feeding ourselves in terms of the thoughts that we're focusing on. All right, let me know your comments on this, and I hope it's helpful. We'll talk to you in the next video. Take good care.